Hey, this is Dr. Josie from Josie Family Orthodontics in Williamsburg, Virginia. By far, the most rewarding part of my job is creating beautiful smiles. Smiles that people can be really proud of. Smiles that people want to show off. Smiles that maybe unlock some of the potential that's within somebody that maybe they're just not willing to show the rest of the world. That's what my orthodontist did for me. That's what I love doing for other people. I want to show you about a case recently that I think is really interesting about the creation of her smile. I want to show you Mackenzie. And what's really interesting about this case is that Mackenzie's parents are both artists. So they have a keen eye for aesthetics. And when I show you Mackenzie's case, you'll be surprised at how we treated her. We decided to take out a few teeth. We took out 2 upper teeth and 2 lower teeth. Teeth in the middle of the mouth, premolars, and then we closed spaces. But I think that it made a profound difference in the aesthetics of her smile. And I'll show you the before and the after at the very end, and you'll see the difference. But what this boils down to is that there have been studies that show that the angulation of one's upper front teeth is something that people perceive as more and less aesthetic depending on the angulation of the teeth. And there's an ideal angulation for the teeth that research has shown that people like the aesthetics of it the best. And so when people have flared teeth that stick out too far, it tends to be perceived as unaesthetic. And most lay people can't really put their finger on why, they just know that they don't like the look of flared teeth. When you put the teeth in the correct angulation, the aesthetics improve dramatically and people tend to like it. And so this case really demonstrates that well. Let me show you. Okay, this is Mackenzie. Mackenzie came to us when she was 12 years old, and she came to us primarily because of the crowding in her lower front teeth. These are her lower teeth when she started treatment, and you can see how crowded those lower front teeth are. When you look at the upper front teeth, or when you look at the upper teeth in general, you don't see a lot of crowding. But I believe that these upper front teeth are a bit what we call protrusive. In other words, they stick out just a little bit too far. Again, I recommended that we treat Mackenzie by taking out some teeth. On the top, we took out this tooth, and on the bottom, we took out this tooth. And on the other side, we took out the same teeth. A lot of people don't understand what happens when we extract teeth, but we start closing space right away after we extract teeth. This is what it looks like at the end of treatment, and you can really barely tell that she's missing any teeth at all. Really, the dramatic change is what happened with Mackenzie's front teeth. And I'll show you her smiling here at the end of treatment. And I like her smile. I'm gonna give you a close-up of those front teeth and show you the difference that was made. So on the left are Mackenzie's teeth when we started. On the right are Mackenzie's teeth when we finished. And it takes a little bit of a keen eye to see the difference. But the difference in the angulation of these front teeth makes a difference in the way that the light hits the teeth. And again, research has shown time and time again that lay people can perceive this difference. Lay people can tell when teeth are sticking out a little bit too much and when they're not. And so I am really, really happy with the aesthetics of Mackenzie's smile here at the end. Her family loved it. Mackenzie loves it. She's proud to show off this smile, and that's what it's all about. But I wanted to demonstrate this case because a lot of times people are scared about extracting teeth. And especially in some cases where there doesn't appear to be a whole lot of crowding. Some people don't understand what extractions can do and what the final result is. And so I think you'll agree with me that the aesthetics here look better at the end. And that's because, in part, we extracted some teeth, but also that it's really not, it's not detrimental to her smile to have taken out 4 teeth. In fact, you can barely tell when you look at the finished result that she's missing 4 teeth. And for Mackenzie, it was a really easy experience to get those teeth out. So it doesn't create a traumatic situation. It doesn't create a bad experience. At the end of the day, it creates a smile that she can be really proud of. And so occasionally we take out teeth. We don't do it very often, but there are some cases where it can really enhance the aesthetics. And I believe that it really does that in Mackenzie's case.